Today I'd like to walk you through a surgical steps of creating a new vagina using peritoneal tissue, also known as PPV vaginoplasty. The first step is to create a tunnel that mimics the natural vaginal canal. This space is carefully dissected between the urethra and the anterior wall of the rectum, going deep toward the back of the bladder, where we closest to the peritoneum lining. In the second step, testicles are removed. However, the scrotal skin is preserved for later reconstruction. Step 3 is to construct the clitoris from the tip of the penis. I always make sure to preserve the full sensory nerves to maintain natural erotic sensation. In step 4, the penile shaft is removed and the urethra is shortened in a female length. During this step, I also preserve the penile shaft skin and pupil skin, which will be used later. In step 5, I use the preserved penile and pupil skin to create the labia minora and the vaginal opening in a refined V-shaped contour. This is a key part of my NPI technique. Step 6 is the creation of the labia majora, which is done using the scrotal skin. Step 7 is performed by my specialized surgical team. We use laparoscopic technique to lift the peritoneum lining from the lower abdominal wall and the dome of the bladder. In step 8, we roll the edges of the peritoneum flap inward and suture them together to form a sealed pouch, like a soft, smooth ball sac that will become the deep part of the vaginal canal. The shiny inner side of the peritoneum becomes the new vaginal lining, which naturally stays moist and can secrete small amounts of clear fluid, one of the unique biological advantages of this tissue. Step 9, where we bring it all together. The new vaginal canal is constructed with two different tissue types. The outermost part near the vaginal opening is made from skin graft because it's more resistant to friction during intercourse. The deep portion of the canal is created by pulling down the raw peritoneum pouch and connecting it to the skin graft using absorbable barbed sutures. This is why the technique is called peritoneum pull-through vaginoplasty or PPV, because the peritoneum pouch is literally pulled through and integrated into the new vagina. The result is a vaginal canal that's typically 6 to 7 inches in depth, lined completely with moist tissue from both the skin and peritoneum. During follow-up, when we examine the new vagina, using a vaginal speculum or endoscope, we consistently find that the appearance and moist texture are very similar to that of a native female vagina. Beyond gender-affirming surgery itself, there's so much more I like to share. Over the years, I also specialize in facial feminization surgery and breast and body feminization, which many of my patients choose to undergo either at the same time as their bottom surgery or afterward when they're ready. So in the next episode, I share more about those procedures, what they involve, how they're done, and what to expect. Thanks for watching and see you in the next video.